A cardiologist recently revealed a breathing technique so effective at lowering blood pressure that when the study results were published, the medical community was stunned. In a controlled clinical trial, participants who practiced this technique for just 5 minutes a day experienced blood pressure reductions comparable to daily aerobic exercise and, in some cases, rivaling the effects of certain blood pressure medications. No pills, no gym membership, no expensive equipment, just 5 minutes of breathing done in a specific way that triggers a powerful physiological response inside your body. If you are over 60 and you have high blood pressure, or if you are taking medication for blood pressure and wish you could do something more to support your cardiovascular health, what I am about to share with you could be a genuine game changer. Because this is not some fringe wellness trend or unproven internet remedy. This technique has been studied in randomized controlled trials, the gold standard of medical research, and the results have been published in peer-reviewed journals that cardiologists around the world read and trust. My name is Dr. Michael Williams, and I am going to teach you this technique today. By the end of this video, you will know exactly how to do it, why it works, how often to practice it, and what results you can realistically expect. I am also going to explain the broader science of breathing and blood pressure, because understanding why this works will help you appreciate just how powerful a tool you have been carrying with you your entire life without ever using it to its full potential. But first, let me explain why high blood pressure is such a critical issue for seniors over 60 and why finding additional ways to manage it matters so much. High blood pressure or hypertension is the single largest modifiable risk factor for heart disease, stroke, kidney failure, and cognitive decline in seniors. It affects approximately 70% of adults over 65, making it one of the most prevalent health conditions in the senior population. And despite the availability of numerous medications, many seniors find that their blood pressure remains stubbornly above target levels, or they experience side effects from their medications that diminish their quality of life. This is where the breathing technique comes in. It is not meant to replace your medication. It is meant to work alongside it, providing an additional tool that can help bring your numbers down further, potentially reduce your medication needs over time with your doctor's guidance, and give you a sense of control over your own cardiovascular health. The technique is called Inspiratory Muscle Strength Training, or IMST, and the specific protocol that has been studied is sometimes referred to as high-resistance inspiratory muscle training. But do not let the technical name intimidate you. The concept is remarkably simple. You breathe in forcefully against resistance and you breathe out normally. That is the core of it. The resistance makes your diaphragm and the muscles involved in breathing work harder than they normally would, and this effort triggers a cascade of cardiovascular benefits that extend far beyond your lungs. The landmark study that brought this technique to widespread attention was conducted at the University of Colorado and published in the Journal of the American Heart Association. The researchers recruited 36 healthy adults aged 50 to 79 with above normal systolic blood pressure, which means a reading of 120 or higher. Half were assigned to perform high-resistance inspiratory muscle training for 5 minutes a day, 6 days a week. The other half performed a sham training with much lower resistance as a control. After 6 weeks, the group performing the actual high-resistance training showed an average reduction in systolic blood pressure of 9 points. 9 points. To put that in perspective, that is comparable to the reduction many patients achieve from daily 30-minute walking programs, and it approaches the effect of some first-line blood pressure medications. The control group showed no significant change, and the researchers found additional benefits including improved endothelial function, which means the cells lining the blood vessels were healthier and better able to regulate blood flow, and reduced markers of oxidative stress. Now let me explain why breathing against resistance has this effect, because the physiology is fascinating and it will help you understand what is happening inside your body when you practice this technique. When you breathe in forcefully against resistance, you are generating substantial negative pressure inside your chest cavity. This negative pressure has several immediate effects. First, it pulls more blood into your heart from your veins, increasing what doctors call venous return. This stretches the walls of the heart slightly, which triggers the release of a hormone called atrial natriuretic peptide. or ANP. ANP signals your kidneys to release more sodium and water, which reduces blood volume and lowers blood pressure. It is your body's own built-in blood pressure reduction mechanism, and forceful breathing activates it. Second, the effort of breathing against resistance activates the sympathetic nervous system briefly, followed by a compensatory activation of the parasympathetic nervous system, which is the calming branch of your nervous system that slows heart rate and dilates blood vessels. Over time, regular practice of this technique strengthens the parasympathetic response, meaning your body becomes better at keeping itself in a relaxed, low-pressure state throughout the day, not just during the breathing exercise. Third, the technique improves endothelial function. The endothelium, the thin layer of cells lining your blood vessels, produces nitric oxide, which is the molecule that signals arteries to relax and dilate. In seniors with high blood pressure, endothelial function is often impaired, meaning less nitric oxide is produced and arteries stay more constricted than they should. The improved blood flow and reduced oxidative stress from inspiratory muscle training helps restore endothelial function, leading to better blood vessel dilation and lower blood pressure. Now, let me teach you how to practice a simplified version of this technique that you can start doing today without any special equipment. While the original study used a specific resistance breathing device, researchers and clinicians have noted that significant benefits can also be obtained through a breathing practice that mimics the key elements of the protocol. Here is the technique. Sit comfortably in a chair with your back supported, your feet flat on the floor, and your hands resting on your thighs. Close your mouth. Inhale slowly and deeply through your nose, taking 5 full seconds to fill your lungs completely. As you inhale, focus on using your diaphragm, the large muscle beneath your lungs. You should feel your belly expand outward as you breathe in, not your chest rising. At the top of the inhale, hold your breath for 2 seconds. Then exhale slowly through your mouth, taking 7 full seconds to empty your lungs completely. Purse your lips slightly as you exhale, creating a small amount of resistance that makes the exhale slower and more controlled. Each breath cycle takes approximately 14 seconds. Repeat this cycle for 5 minutes, which gives you approximately 20 to 22 breath cycles. Practice this once or twice daily, ideally at the same times each day to build a consistent habit. Many of my patients do it once in the morning before getting out of bed and once in the evening before sleep. For those who want to add resistance, which the research suggests amplifies the benefit, you can practice inhaling through a thin straw or through nearly closed lips, which forces your inspiratory muscles to work harder to pull air in. There are also commercially available inspiratory muscle training devices that provide calibrated resistance and are specifically designed for this purpose. These devices are relatively inexpensive and can be purchased online or at medical supply stores. Now, what results can you realistically expect? Based on the research and my clinical experience, here is what most seniors see. During the first week, the effects are primarily acute. You may notice that your blood pressure is slightly lower immediately after each breathing session, and that you feel calmer and less stressed. These immediate effects are real but temporary, lasting for about an hour or two after practice. After 2 to 3 weeks of consistent daily practice, the effects begin to become more sustained. Many of my patients notice that their blood pressure readings throughout the day, not just after breathing practice, begin to trend downward. They also report improvements in stress levels, sleep quality, and overall sense of calm. After 6 weeks, which was the duration of the landmark study, the full benefits are typically established. Blood pressure reductions of 5 to 9 points systolic are common in people who practice consistently. Some patients see even larger reductions, and these benefits are sustained as long as the practice continues. I want to also share some additional breathing practices that complement the resistance breathing technique and that have their own evidence base for blood pressure reduction. The first is called 4-7-8 breathing. Inhale through your nose for 4 counts. Hold for 7 counts. Exhale through your mouth for 8 counts. Repeat 4 times. This technique was popularized by Dr. Andrew Weil and is particularly effective for calming the nervous system before sleep. The second is coherent breathing, also known as resonance breathing. This involves breathing at a rate of approximately 5 to 6 breaths per minute, with equal inhale and exhale durations. For example, inhale for 5 seconds, exhale for 5 seconds with no pause. This rate has been shown to synchronize your heart rate variability in a pattern that optimizes cardiovascular function and promotes parasympathetic activation. The beauty of these breathing practices is that they can be done anywhere, anytime, and they are completely free. You can practice while sitting in your chair, lying in bed, waiting in a doctor's office, or even during a quiet moment in your day. They require no equipment, no preparation, and no physical fitness. They are accessible to virtually every senior, regardless of mobility, health status, or living situation. However, I want to add an important caveat. While these breathing techniques are remarkably effective as complementary approaches to blood pressure management, they should not be used as a replacement for prescribed medication without your doctor's explicit guidance. If you begin practicing these techniques and your blood pressure improves, that is wonderful, but do not adjust your medication on your own. Instead, bring your home blood pressure readings to your doctor and have a conversation about whether your medication can be adjusted. Many doctors are open to reducing medication when lifestyle changes produce sustained improvements, but this must be done under medical supervision. Let me also mention that the benefits of structured breathing extend well beyond blood pressure. Regular practice has been shown to reduce anxiety and stress, improve sleep quality, enhance cognitive function and focus, reduce chronic pain perception, boost immune function, improve heart rate variability, which is a marker of cardiovascular health, and promote a general sense of well-being and calm. For seniors over 60 who often face a unique combination of physical health challenges, emotional stress, sleep difficulties, and cognitive concerns, a daily breathing practice addresses multiple dimensions of health simultaneously. It is, in my opinion, one of the most underutilized tools in senior health. Let me recap what we covered today. High-resistance inspiratory breathing has been shown in clinical trials to reduce systolic blood pressure by an average of 9 points in just 6 weeks. The technique works by improving venous return, activating the parasympathetic nervous system, and restoring endothelial function. You can practice a simplified version by doing 5 minutes of slow, deep diaphragmatic breathing once or twice daily, with optional resistance through pursed lips or a thin straw. Results begin within weeks, and with consistent practice, the benefits are sustained and significant. 5 minutes, that is all it takes. 5 minutes a day to give your cardiovascular system a tool it has been waiting for your entire life. If this video introduced you to something new and valuable, please subscribe to this channel. I share new content every week focused on practical, evidence-based strategies that help seniors take control of their health. And if you know someone over 60 who is struggling with high blood pressure, please share this video with them. 5 minutes of breathing could be the missing piece they have been looking for. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Breathe deeply and take care of yourselves.